Welcome to your health and lifestyle show. I am your host, Lucky Mbabazi, and today we shall be looking at oral health. We all love to have that nice smile, but to have it, what do you need to go through? I do have Dr. Kriti Jain, I hope I got it right, who is a dental surgeon at UMC Victoria Hospital, and Dr. Juko Edrin, the Chief Medical Officer at Victoria Hospital. Good to have you once again, and good to have you for the first time. Okay, so we just generally define the whole health. When somebody says oral health hygiene or oral health, what does it exactly mean? Is it just, are we just looking at the mouth, or there's more to it?
Actually, basically we are just looking at the mouth.
Okay.
But the hygiene inside the mouth, it also affects our whole body.
Right.
Like if we don't have proper teeth, then we don't chew our food nicely. So it affects the intestines and basically the stomach and everything. And secondly, our mouth contains a lot of bacteria. If you have a lot of dirt inside your mouth and on your teeth, then these bacteria can also, affect your heart basically and other things inside the body as well. So you really have to take care of your oral health.
Yeah. Before we look at the major complications when it comes to teeth, I think we need to just go back to the basics.
Yes.
Because most people tend to think that they know, but they really don't know how to clean their teeth. Okay. I know it sounds like, we should be knowing how to brush our teeth, but I surely know there's a technique on how you should brush your teeth. Maybe we start there.
Okay.
Yeah.
Actually, brushing is very important. Everybody brushes twice a day, whoever comes to my clinic, but the technique is not right. They don't know actually how to brush.
Right.
So I have to teach them how to brush, right? So how to brush is basically you take the brush, you hold it at an angle of 45 degrees to your teeth, and then just do small circular motions, and that is all. Just brush 10 to 15 times on one teeth, and that is
10 to 15 times? Do you like, because the brush,
you don't have to overdo it. No, you don't have to overdo it. It's very light touch, because if you overdo it, you can erode your teeth, and that is more dangerous.
Right.
So you just have to do it lightly and in small circular motions. You just don't have to do it right, left, don't do that. It's just small circular motions, and 10 to 15 times you just spend, and that is okay. That is enough, and twice a day.
Some people will say that, okay, there's that twice a day, and then some say that you should brush your teeth every time you eat.
Yeah, it is.
Is that something you would recommend, or can it affect your teeth?
It can affect your teeth. You don't have to brush every time you eat, because you might eat 4 or 5 times a day. You can't keep brushing all the time, because it can erode your teeth, it can abrade your teeth, and it is more dangerous. So you just brush twice a day. After every meal, you just rinse your mouth with water, and that is good enough.
Okay.
And while you brush, you just floss also in the night, so that is very nice.
All right, now you've talked about flossing and the brushing, but in most cases, people also worry about the gum. When you're brushing your teeth, are you supposed to also brush your gums? Because the toothbrushes that we have, in most cases, if you put it on your gum, they seem a bit rough, and then your tongue too.
Yeah. So you don't have to brush your gums. The toothbrush which we use, they are not supposed to, use on your gums.
Right.
For gums, first you brush your teeth, then you clean your tongue. That is very important, that you have to clean your tongue.
How do I clean my tongue? Do I use the same toothbrush?
Yes, you can use the same toothbrush.
Right.
Some toothbrushes on their back side, they have a tongue cleaner, some don't. So if they have a tongue cleaner, you use that. Otherwise, very lightly, just use the same toothbrush on your tongue, and that is about it. And for the gums, we have different gum paints which are in the market. For the gums, you can use that. Just use an earbud or your finger and just massage your gums once a day, and that is good for the gums.
Okay. So a lot of us are also concerned about the types of toothpaste that we use. And before we even get to the types of toothpaste, I know that toothbrushes come in, I don't know if I should call them sizes. When you go to the counter in the supermarket to get yourself a toothbrush, you'll find medium, then you'll find, I don't know, hard, and
yeah.
Which one is appropriate to use, and does it vary from one person to another?
The most appropriate one to use is a soft one to a medium one. not a hard one.
Okay.
Okay, so basically the best is the soft one, because we just want to clear the plaque which has developed, a sticky substance which develops on our teeth because of our food.
Right.
We just want to clear it, nothing else. So we just do it very softly and use a soft toothbrush, that's all. No hard, no medium.
Okay. You will find that some people complain that when they brush their teeth, the inner is very hard to reach.
The inner
No,
part.
forget about the outer part you brush,
yes.
but then inner.
Okay.
Even when you pass your tongue a bit, you'll find that it's as if it's stained even if you have brushed. What is the proper way of doing? That's a hard one, yeah.
I don't have a model, otherwise I would have taught you that.
I wish we had, yeah. Yeah, but you can use your hands. I
Yeah,
think we'll
we can
get
use,
it.
if this is my hand, I'll just do like this on the inner side. Just move your wrist in the clockwise or anti-clockwise direction and it is done.
Okay.
You just have to check that after brushing and after rinsing with water, you move your tongue on your teeth. They should all feel smooth. There shouldn't be any roughness on your teeth.
When you're done. And
when
if you
you're
feel
done,
any roughness, that
you
means
go
you're not
back
doing
again.
a good job.
Yeah, you go back again, you just clean that area again, rinse it again and then feel it again.
Okay.
And then after that you floss in between your teeth to remove any particles, because a brush, it doesn't go between the teeth, the bristles, because our contacts are very tight in between the teeth. So a floss is very thin and you're supposed to, hold it tight so that we break any plaque which is stuck to a tooth surface.
You'll find that some people have, what's the word I'm looking for? They have crowns.
Yes.
In their you have normal teeth and then you have the crowns. Is the cleaning of both different, like from a crown to a normal tooth?
No, it is not different. A crown is treated as our own natural teeth, because it's just a cap on our teeth and it is made in a way that it resembles the natural teeth completely. So there's no difference in cleaning. You could brush on it also and you floss around it as well.
Right. The issue of toothpaste.
Yes.
Yeah, does it really matter what kind of toothpaste I use? Is there a type that, people should, I'm not asking you to give us a brand, because then you'll be promoting them.
Yes.
But is there a type of toothpaste that...
See, basically you can use any toothpaste, all right, but few people who are more prone to cavities, who have more dental decay, they should use a fluoride toothpaste.
Okay.
There's a compound called fluoride. It helps, it prevents basically demineralization of the enamel. Enamel is the hardest substance of our tooth. It is the outermost covering of the tooth. Okay, so fluoride helps in prevention of the demineralization of the enamel.
So you should always look for that while you're
if you have more teeth decay, if you have more cavities in your tooth, then a fluoride is very helpful because it prevents cavities. So you can look for fluoride in your toothpaste, that will be helpful for you.
There is a lot to talk about when it comes to teeth. Before we even move on to the other complications of our teeth, we need to look at our children.
Yes.
In most cases, we as parents do not know when do we start cleaning our baby's teeth, and if we start, how do we do it?
Yes.
Yeah.
So first of all, first and foremost thing is that children should be taken to a dentist at the age of around 1.
Right.
Right, so that they have a few teeth in their mouth at that time, and so a dentist should be able to see that are they coming properly, is there any problem in the teeth, any problem, all right. And before 6 months of age, when there are no teeth in a baby's mouth, you clean it with a soft cotton. You just take soft cotton, you wet it in water and you just clean the gums with it.
Just water?
Just wipe it with water, the gums.
Right.
Because after the baby has had milk or anything, just wipe it before the baby sleeps. It keeps the gums healthy.
Right.
Now after that, after 6 months the teeth start coming. When the teeth start coming, you just take a little bit, take a very smallest toothbrush. There are finger brushes which come in the market for very small babies till 1.5 years of age. They fit in a finger, all right. They're very soft. You just take a rice grain size of a fluoride toothpaste for a child.
Right.
Fluoride is very important for children because they help in preventing cavities.
But then they have fluoride, they have their special toothpaste.
Yes.
Is it a problem if my child uses our toothpaste? What are the effects of that? Because I've noticed is, yes, baby toothpaste, but then what if you use my toothpaste?
See, the content of the toothpaste are different. The percentage in our compound a child requires, a percentage is very less, and an adult requires the same thing in a large percentage. So therefore the toothpastes are segregated. The child has a different, the fluoride in a child's toothpaste is very less, and in an adult toothpaste the percentage is quite more.
I see.
So if you start using adult toothpaste for a child and it's fluoridated, then the child can have excess of fluorine, all right, and it can cause Fluorosis,
yeah, some
so it causes
complications.
white spots in the child's teeth and complications. like
Yeah,
that.
before we even move on to the adults, I think let's start with the children problems when it comes
Okay.
to teeth. There's a time my daughter had several cavities because we
Okay.
didn't take care of her teeth very well.
Yes.
And we learned the hard way. And I took her to some dentists, very reputable hospital. They did check her, and then they said they didn't call it a root canal. They called
Yeah.
it something else, but really it's an equivalent of a root
It's
canal.
called pulpectomy.
And I was a little worried. Isn't
Yeah.
it aren't they too young for that process or for that procedure?
See, it's called pulpectomy. We
Right.
do that in baby teeth, but it is very important to do that because a child's teeth, they start falling at 6 years of age.
Right.
All right. Till that time, we have to maintain that space. The space which a milk tooth acquires, we have to maintain that space so that when new teeth come, they come at a proper alignment.
Right.
If we don't maintain that space, if there's cavity and the child, we just take out that teeth. So the surrounding teeth, they just start coming like this, and they don't provide proper space for a permanent tooth to erupt.
Right.
So we have to maintain it. So we do a pulpectomy that saves the tooth and it maintains the space. And then when age comes, the tooth itself falls off and a new tooth comes in its place.
Or what if you left it and they just wore, what do they call them?
Fillings.
No, not braces. Yeah. Wouldn't that help?
Braces.
Because I see lots of children with teeth that are
See,
uneven
braces,
or have the
yes,
yeah.
braces is a very helpful treatment plan. But when we can save the child's teeth by another procedure, why do you want to go for braces? Braces is a very long-term treatment plan. It takes around 2 to 3 years for the complete treatment to occur, and then also there are a little chances of relapse. The child has to wear retainers and many things.
Yeah, it's more complicated.
Yeah, it's more complicated.
So now that we have done a bit about children, there's more, by the way. We can go on and on and on and on, and we'll find ourselves just talking about the children. Let's go to some of the major problems in our teeth, the most common.
Okay. So first and the foremost.
Maybe you hold it there.
Yeah.
We'll go for a break.
Okay.
When we come back, we look at some of the major and the most common problems with our teeth. You're still watching your health and lifestyle show. We are discussing your oral health. Welcome back. We are still looking at oral health. You're with me, Lucky Mbabazi, on your health and lifestyle show. Thank you so much for finding some time to be with us. And I still have Dr. Kriti Jain, who is a dental surgeon at Victoria Hospital, and Dr. Juko Edrin, who is a chief medical officer at Victoria Hospital. Now, before we went into a break, I think we wanted to break down the most common problems when it comes to our teeth.
Okay, so first and the foremost is bad breath, which is also called as halitosis. Almost 85% of people suffer from it. And usually people don't come to know about it. It's the other people who tell them. And
if they tell you, because in most cases we are scared to tell our peers that.
But near and dear ones and the relatives do tell you.
Yeah.
And 90% of the time, bad breath is related to an underlying dental condition.
Right.
So the first and foremost is this, bad breath. Secondly, what is most common is tooth decay, or what we call as tooth cavities. They are basically caused by the acid which is formed in our mouth, and acid is formed by the sugar and the starchy food intake that we take. The sugar in the food and the drinks which we take, it reacts with the bacteria which is present in our mouth, and it forms acids. And these acids then demineralize the enamel, and it causes tooth cavities.
Right. Going back to you called it halitosis?
Yes, bad breath.
Yeah, going back to that bad breath, I think it's very important you give us more.
Okay.
Some of the causes of it. I know, yes, it could be something to do with the teeth, but I've also read somewhere that sometimes it's not the teeth.
Yeah,
that
it can
you could
be
be having
systemic.
organs
Yes.
that,
Most especially if you have gastroesophageal reflux disease. Reflux of acid from the stomach toward the esophagus to the mouth. It can easily cause halitosis.
Okay, okay. And if you have it, what are some of the solutions to that before we move on to another problem?
See, if a person has come with a bad breath to me, the first I will do an oral checkup. I will see what can cause bad breath in this person. Something like a tooth cavity can cause it. Something like a gum infection.
Yeah.
If there's any gum infection inside it, that can cause a bad breath. Then if there's no oral cause, if the tongue is not clean, even that can cause bad breath. If there are a lot of deposits inside our tongue, or even if the tooth has a lot of deposits, that can also cause bad breath. So I'll treat all the oral causes. If still the person has bad breath after treatment of the oral causes, then probably I'll just transfer the person to a physician to see that what else can be caused.
There's a time, I think I was speaking to some dentist who told me there's a way you can find out that you have halitosis, like a personal examination. I think he said
you just do put, and you can smell it.
That's different, because sometimes when you do this, you don't actually smell it. Yeah, but he said you put saliva on maybe your wrist and then smell it. Does that work? Is that a personal examination that you can do?
No, I don't think that will work, because if suppose I don't have a bad breath and I have eaten something which might cause a bad breath, something like onions, garlics or something, etc., and then I put my saliva here,
it's not going to smell good.
And even if morning saliva, morning breath is not quite good, you know. So even if a morning I put my saliva here, let it dry and then smell it, saliva will always have some kind of a smell to it. So I don't think it can be used to judge if the person has a bad breath. The perfect thing is to, you know, other people.
Go for it. There's a friend I had who had problems with her gums.
Yes.
They would bleed.
Yes.
What is that? Like they would bleed constantly, even if she's not brushing or she hasn't brushed so hard, they kept on bleeding and bleeding and bleeding.
Yeah, so that is a gum infection. In our terms, it is called periodontitis.
Right.
All right, that happens because of the deposits which occur on the tooth, the bacteria, then they seep inside the gums and they cause the infection there. And it can be so severe that it might be a cause for tooth loss. The tooth becomes shaky and they just lose it.
Can it affect the whole mouth? Because the blood was random, it was coming,
It is, it affects the whole mouth. If you are not maintaining your hygiene properly, if there's a lot of deposits and your gum has been infected, then it will deposit, it will affect the whole gums.
Okay.
So you have to be very vigilant about it.
That tooth breaking, sometimes we get accidents that you can't avoid, God forbid.
Yes.
You're moving, you probably fall and your teeth falls out. I know for sure that they can put that tooth back, isn't it?
Yes.
So when I get such an accident and I can see my tooth, how do I reserve it to get to a dentist before?
Okay.
Yeah.
It's a very genuine question actually.
Yeah.
Suppose a tooth falls off, just put it in milk.
Milk?
Yeah.
Okay.
Either milk or just in person's saliva. Okay. The person's saliva or milk. It preserves the fibers which the tooth is attached to the bone. There are fibers in between the tooth and the bone. So those fibers are preserved. And within 30 minutes of time, that tooth can be reimplanted inside the patient's mouth.
So it has to be 30 minutes.
Yeah.
If it's more than that, it's gone.
It's gone. The fibers then degenerate after 30 minutes.
So how do you insert it? Of course you use,
we clean everything.
The technicalities of
we clean the socket, we clean the tooth, everything, then we reimplant it and then we just tie it around with the other teeth and make it stable.
Okay.
And then the person is not supposed to eat for a few days, they're just on liquid diet and all, then tooth stabilizes. It reattaches, the fiber reattaches themselves to the bone.
Okay, so what are some other common, besides, there's also the issue of color.
Yes, staining of teeth.
Yeah, staining of teeth.
Yes.
You find that today you have white teeth and then all of a sudden, gradually the color changes,
yes,
turns
not all
to
of a sudden.
yellow, depending.
See, that's staining of teeth. So staining can be, it can be categorized basically, the staining. It can be the extrinsic stains due to the outside environment. That is whatever we eat, whatever can color our clothes can color our teeth as well.
Right.
Okay. So all the dark things like red wine, all the sodas, then all this balsamic vinegars or every dark thing.
Even the juices like mango juice.
Then berries and everything, they can all stain our teeth.
So how do we avoid, how do we avoid a stain? Because you're not going to say, I'm not going to take soda or I'm not going to take juices.
Even tea and coffee, they also cause stains.
So how do I avoid?
To avoid them, just rinse your water. After you have had them, you just rinse your mouth with water and the stains are gone.
Without necessarily brushing your teeth?
No, you don't have to brush. If you're having tea 5 cups a day, you can't brush exactly 5 times a day. You just rinse with water and keep your teeth clean.
Is it possible to have this, there's this dark black circles in your teeth and you don't necessarily have a cavity?
Dark circles in your teeth?
Yeah. You've seen people with teeth but then they have black spots on the teeth and they say it's not a cavity, they're just,
Yeah,
what kind of stain is that?
That's a teeth which has deep crevices on it. So you have to maintain them. You definitely go to a dentist and the dentist tells you, yeah, it's a deep crevice on the teeth which has turned darkened because the stains have penetrated inside.
Right.
Okay, but it is not a cavity, so you don't need a filling actually, but you just maintain it.
Do I need a cleaning?
Yes, you
On it?
definitely cleaning, but not necessarily that cleaning can go inside the crevice and clean it properly. But yes, you maintain it a little, it becomes a little brownish after cleaning, but that is okay. You can maintain it like that.
Any other common, before we actually move on to the procedures that are needed for, for certain complications, especially when it comes to your teeth? We have already looked at halitosis, which is the most common. The dental cavities?
Yes, which probably she's well versed with. In 2005, we don't have a lot of studies in Uganda in the dental field.
Right.
But in 2005, when we did a couple of studies in Arua, Kampala, Mbarara, and Mbale, the commonest places which are urban, because most of our dentists are actually in peri-urban areas, just surrounding there. They discover that they have a lot of dental caries. Of course, as people grow older, they forget about their teeth.
Yes.
So in that study, 40% of the children had dental caries, and 62.5% of the adults had dental caries.
That study was done in those areas?
In those areas.
Okay.
And they discovered that most dental caries were in Kampala, as per se. So we see that as adults, people grow into adulthood, we have more people actually getting dental caries than the children. So that it's a very big public health problem.
Okay. Now, if it's a problem, of course, it needs a solution.
Yes.
So maybe you provide us with one. Because the issue is the problems are there. But if we know the solutions and perhaps, or some things that we can avoid to do, then maybe we will protect our teeth.
See, how can we maintain our teeth? By brushing twice daily. That is the ultimate thing. And the brushing technique, like I already told you, that should be proper. Then at least once a day, we should floss our teeth. That is very important because usually the dental cavities which occur, it is between our teeth. Not on the top surface, but between our teeth, because the food particles get stuck there and they're not able to come out. So when we floss, then they come out. So that is very important. Then we should avoid too much starchy or sugary stuff. And we should have minimum mid-meal snacking, okay, to prevent this sugar acting on the bacteria and the acid production, which leads to the cavities.
Right.
All right.
How about the issue of toothpicks? You talked about flossing, which is amazing, but then not so many people know about it, and not so many Ugandans floss actually. They go for toothpicks mostly, and then I've heard and I've read somewhere that they could have effects on your teeth.
Yes.
You can correct me if I'm wrong.
Toothpicks are actually not advisable
Right.
because the size of the toothpick is quite big. Okay. So first and foremost is you can damage your gums with it. All right. Secondly, when you are using a toothpick, you're increasing the space in between your teeth, which is not good. You are giving more space for the food particles to enter there.
And hence the cavities and
Hence
more
the
problems
cavities,
in your teeth.
yeah, it's a vicious circle actually, which goes on. So toothpick should never be used. I always advise the patients, please don't use toothpick. Floss is the only thing because floss is very thin. It goes easily between the teeth.
Can I just use a thread? Because a floss is really a thread. Hey, what's wrong with you people? People are trying to save money.
See.
There are not so many Ugandans who actually go for flossing. So if a thread can work, I need to find out from the professional.
No, the thread actually will not work as good as a floss because floss just slides down. It is waxed. The surface of the floss is waxed. But the thread is a cotton kind of a thread.
Yeah.
It will not slide properly and it will hurt your gums. A floss will never hurt your gums because it has wax coating on it.
Okay, so let's go for a break. When we get back, we need solutions. Root canal, what procedures do we need to take? You're still watching your health and lifestyle show. And by the way, you can follow us on Twitter. Our hashtag is @NBS Health. Welcome back. It's your health and lifestyle show. Thank you so much for finding time to be with us. And we are pretty much discussing your oral health. I still have Dr. Kriti Jain, who is a dental surgeon at Victoria Hospital, and Dr. Juko Edwin, who is a chief medical officer at Victoria Hospital. So maybe we move to the solution. So you have a cavity.
Yes.
You have a cavity and it needs to be checked. Should I always do a root canal, by the way? I've jumped to the root canal because I hate it. And besides being expensive, it's very painful. So when you have a cavity, what should you do? And when do you know that you have a cavity? Before you actually go to a dentist, how do you find out?
Yes, so that is very important question, that when does a person know that they have to visit a dentist?
Right.
First and foremost thing which happens is sensitivity. When you are eating or drinking anything, you will feel sensitive to hot or cold.
Right.
That is the first indication that people should visit a dentist, but they don't. They start buying over the counter those sensitive toothpaste, and
Put
they start
salt and water.
Yeah, they start using that, and they just delay the process to
Right.
come to a dentist. Secondly, when you should visit is when you start having pain on biting. There's some pressure you feel when you are chewing the food, then you should immediately visit a dentist. Otherwise, when you have ultimate is when you have pain and swelling, then you have to visit a dentist. You don't have any other option left.
Right.
So when you come to a dentist, if a patient comes to me who has just sensitivity, I'll check his teeth. Sensitivity can be because of a cavity. So we just do a filling, we take an x-ray, we do a filling, and that's about it. The patient is happy to go.
And once you
And
have
there's
that,
no pain.
once you have that feeling, can it reoccur?
I've already
How do
filled
I
it.
take care of it?
You just have to brush and floss and nothing else.
And that's it,
That's
nothing
it.
else.
If a filling has been done, it's just done. It's about it.
Maybe Dr.
And the
Kriti,
yes.
why the X-ray? Why the X-ray?
We take an X-ray to see how deep is the cavity.
Okay.
We need to see that because there are 3 layers to a tooth. So we need to see in which layer is the cavity gone. It's enamel, then dentine, and then come the nerves, which is in the pulp chamber. So we just need to check that our cavity isn't in the pulp chamber. If it's in the enamel and the dentine, we just fill it. And if suppose a patient comes with pain, swelling and something, then obviously the cavity has gone deep.
Right.
It has reached the nerve supply in the teeth, in the pulp chamber, and the infection has gone down on the roots.
That's
then
when
we
you
have
go
to do
for the root canal.
Yes,
Yeah.
then we have to do a root canal treatment.
The root canal procedure, I know, comes in stages. How many stages, or it really varies from one person to another?
It varies from person to person. It can be done in a single sitting.
It can?
Yes,
Yeah.
it
I
can
didn't
be
know
done.
that.
Yeah.
Oh, really?
Yeah, we do one sitting root canals. They're very common.
Does it really matter? Does it depend on how deep?
It depends on
Oh.
the symptoms basically, that the infection hasn't reached the periapical area or the root of the teeth.
Right.
If the infection hasn't reached there and the cavity is just very deep and near the pulp chamber and we have to do a root canal, we do it in single sitting. But if you have infection which has reached down, you have a lot of pain, you have a lot of swelling there, then it cannot be done in single sitting. Then we take around 3 sittings for a root canal.
Is it important to crown after
It is
every root
very,
canal?
very
or-
important. It is very, very
Why
important.
is that?
Because see, what happens in a root canal is a very straightforward procedure in which we remove the nerve and the blood supply of our own teeth and we fill it back with an artificial nerve.
Right.
All right. So the tooth becomes a little brittle. It doesn't have its own nerve and blood supply. So to prevent that, to prevent the tooth breakage, we crown it to give it strength so that the tooth remains with you for a lifetime. If you don't crown it, like some patients, they just get the root canal done, their pain is gone, they don't come back for a crown. So what happens is the tooth can break at any point of time. You'll not know, you're eating just a pizza and the tooth will break.
The issue of being pregnant and having cavities, I think the debate has been on whether or not it's possible to go through standard procedures when it comes to dental issues when you are pregnant. Maybe you need to clarify on that. If I'm say 6 months pregnant, 8 months pregnant, or the first few weeks of pregnancy, can I visit a dentist?
Yes, you can visit a dentist. There is no problem in doing small cavities. If you need a filling or maybe you need a root canal procedure, it can be done easily.
A root canal can be done?
Yes, there's no problem.
Does it matter which stage you're at during your pregnancy?
See, the second trimester is supposed to be a very safest period. Even if we are supposed to do a root canal, we prefer in a second trimester. But if the patient is in pain and they cannot bear the pain, because root canal pain is very severe. If you don't have a root canal, you need a root canal, the pain is very severe. And the mother, if cannot bear it, you have to start a root canal. It's just there's a position to sit on a dental chair. It's the left, we just turn the patient towards the left side. So the patient is quite comfortable even during pregnancy and we can do it.
Sure. In pregnancy, you know, when we're judging pregnancy and the intervention that we have to do, we do in terms of risk versus benefit. Always. Even when it comes to drugs, The class A drugs that we use will always be safe in pregnancy, but when we reach class B, class C, then we're weighing.
And also, of course, that type of
than-
pregnancy,
Yes.
because some
Yes.
people have complicated
Yes.
pregnancies. You don't want to be
The
starting
precious
any
babies,
sort of
basically.
Yes.
If you're having
procedure.
a child at 35, we may decide to delay giving you anything because we know that's a precious child, it's a firstborn. So most times we're just weighing risk versus benefit.
That's interesting. Okay, now we have looked at the root canal, and we earlier on discussed whether or not it can be done on children. Can it be done on children who are below 5 years?
Yes, it is done. When the child has a very deep cavity and the child comes with a lot of pain, you have to do a root canal, but it's called pulpectomy in children. We remove the pulp and we fill it with calcium there, so that when the milk tooth is reabsorbing back, the calcium also reabsorbs, and the permanent tooth comes easily. We don't do a permanent filling inside the roots, we just put calcium there.
Can I bypass the root canal? Because in most cases here, I'm asking this question because generally Ugandans don't love to go for these procedures, and they say they are pretty expensive. If somebody is trying to get, oh, that's the honest truth, some of them will be like, it's a lot of money, they're not putting value to, you know, you need this now, you need to fix it. Can it be bypassed or no? If it's a root canal, it's got to be a root canal or nothing.
It cannot be bypassed. If it is a root canal, it has to go for a root canal. Otherwise, it's only extraction. The tooth has to be removed.
How about these things we hear on the market? Oh, you can use this, put it in your teeth, and then for some reason the hole will disappear. There's several on the market.
There's nothing which can make a cavity disappear. If there is a cavity, there's demineralization. The enamel, the dentine, they have all gone from that area. So you cannot remineralize. There's nothing in the market right now which can, you know, just rebuild your tooth and you don't have to go to a dentist, nothing.
Maybe the question should be, what if I don't have a root canal and the infection has gone down into the gums? What do I do? Well, what is the risk that I run?
Because it's the same thing.
I know for a fact that most especially in children, when we have dental problems, whether it is post-dental extraction or we have infections in the tooth that have reached the gums, we risk children getting what we call rheumatic heart disease.
Right.
And it is an infection which comes still through the dental area and goes to up to the valves of the heart, and then we end up with children who are going to heart failure and the like. So most especially children who are below 12 years. So when she talks very passionately about these conditions, that's what we risk. And then for adults, of course, we are more worried about what we call infective endocarditis, which still can come, throat infection coming as a result of that as well. So it is very important to know that, you know, looking at your teeth and doing good oral health is very important for the sake of us.
Okay. Teeth whitening. You know, I've had people go to dentists to just make their teeth whiter. I don't think that procedure is needed. I think it's for cosmetic. You would call it cosmetic surgery. If my teeth are brown and I want to give them color, does it have any effects, by the way?
Not really. It's called bleaching.
Yeah, I didn't want to use the word bleaching because, you know, because of the stigma surrounding the bleaching bit.
It's called tooth bleaching. It doesn't have any side effect. It's just that when we do bleaching, the shade goes 3 to 4 shades lighter of the teeth, and it's just surrounded by little sensitivity of the teeth, which you'll have for next 15 days or so. And that's about it. Then the teeth are fine.
You don't have any other complications afterwards.
And you just have to take care that the dentist has to protect the gums. The bleaching thing doesn't go onto the gums and all. That's all.
And once it's done, can it go back to another color? Do I have to, like people who keep
you have to maintain
bleach their skin, you keep on going back for another procedure?
See, a lot of bleaching is not recommended because it obviously affects the tooth enamel after a number of times. So maybe once in a while you can go for it, but not regularly.
Okay.
Not advised.
I've seen different crowns being used. There's the crown that you need, say for example, after procedure, root canal, and they do a crown, you need it.
Yes.
But I've seen people wear crowns where it's not needed, and little decorations here and there. Do they have any effects? Oh yes. Do they have any effects? And can I just walk into your the hospital and you do that for me?
Yeah, it's called tooth jewelry.
Okay.
We do it. We just it's up to your choice that where do you want the tooth jewelry to be done, in
Okay.
which teeth. Basically, it's the anterior teeth which will be people prefer.
And
we
it's
just do it.
permanent?
Yeah, it's permanent.
No issues
The
there.
teeth start sparkling.
With gold teeth as well.
With gold teeth as well. So now, as we conclude, is there anything else that you'd like us to know before we go, because we are pressed for time?
Yeah, I like to emphasize on the loss of teeth. People, ignore when they don't have teeth, but actually they shouldn't ignore that, and it is very important that you have all your teeth present in the mouth.
For self-esteem purposes, and then for also the
Proper
eating,
chewing
yeah.
also,
Yeah.
because if the food is not properly chewed, then it affects the intestines and the stomach as well. So there are ways on which we replace the teeth. They can be crowns which can be put. Then the latest is implants, which we do, dental implants.
How does it work?
Dental implant is that it's a titanium screw kind of a thing which we put inside the bone, and yeah.
Sounds painful.
No, it is not painful at all. We numb the patient. We numb that area, just that area, not even the whole body. We just numb that area. We put inside, and it is as good as a normal permanent tooth.
I've seen the new braces on the market. I think they're invisible.
Yeah,
Is
they are
that
clear
kind of-
aligners. They are clear
And
aligners.
do you have for kids as well? And
Yeah.
is the cleaning the same?
The cleaning for the braces.
Yeah.
Yeah, you have to take a good care of cleaning while braces. You have to floss, you have to brush 2-3 times a day, and you have to visit a dentist every 6 months.
All right. Well, I think that's all that we had for you today. We have to go. Unfortunately, I'm pressed for time. Thank you so much, Dr.
Yeah.
Kriti Jain,
Welcome.
dental surgeon at Victoria Hospital, and of course, Dr. Juko Edrin, who is a chief medical officer at Victoria Hospital. It's a pleasure.
Thank you so much.
That's all we had for you on the Health and Lifestyle Show. Be kind to one another. Till next time, God bless you. Bye.